Have you ever wondered what happens to your body when you are bitten by a poisonous snake? Imagine you're out enjoying a leisurely hike in the woods, or perhaps you're just doing some yard work, and suddenly you feel a sharp sting. You look down to see a venomous snake slithering away. It's a nightmare scenario for many, but it's an all-too-real possibility in certain regions of the world. Venomous snakes, while often feared, are an integral part of our ecosystem. Their bites, although rare, can have profound effects on the human body. You see, when a venomous snake bites, it injects a cocktail of toxins into its victim. These toxins, or venom, can cause a range of reactions in the body, from mild irritation to severe, life-threatening symptoms. So what exactly happens when a venomous snake bites? Let's unravel this mystery. Join us as we delve into the fascinating, sometimes frightening world of snake venom and its effects on the human body. When a venomous snake bites, it injects a toxic substance called venom into your body. This venom is a complex mixture of various proteins and enzymes. But what exactly is this venom, and what does it do to your body? Let's unravel this mystery. Venom is essentially a highly specialized saliva that snakes have adapted over millions of years to serve two main purposes. First, it helps immobilize their prey, making hunting a lot easier. Second, it begins the digestion process even before the prey is swallowed. There are different types of venom, each with its unique composition and effects. The two main types are neurotoxic and hemotoxic venom. Neurotoxic venom primarily affects the nervous system and the brain, leading to symptoms like blurred vision, difficulty in speaking and breathing, and in severe cases, paralysis. On the other hand, hemotoxic venom impacts the circulatory system, causing internal bleeding and damage to the heart and blood vessels. Now let's talk about the bite itself. When a snake bites, it's like a hypodermic needle. Two long, sharp fangs puncture the skin and underlying tissues, injecting venom deep into the victim. The amount of venom delivered can vary greatly and depends on a variety of factors, such as the snake's size, age, and species, as well as the intensity and location of the bite. Once the venom is in your system, it starts its destructive work. It spreads quickly through the bloodstream, carried to every corner of the body. The onset of symptoms can be immediate or may take a few hours, depending on the venom's potency and the volume injected. To sum up, a snake bite is not just a simple puncture wound. It is a complex biochemical event that can have severe and potentially deadly consequences. Understanding the nature of venom and how it affects the body is crucial in appreciating the seriousness of a venomous snake bite. Now that we know what venom is, let's dive into how it spreads in your body. Once inside the body, venom starts its destructive journey, interacting with your cells and tissues. The venom, being a complex cocktail of proteins and enzymes, is designed to break down the prey from the inside out. In humans, this can feel like a raging fire coursing through your veins, a vivid illustration of the venom's destructive potential. The venom is quickly absorbed into the bloodstream from the site of the bite. The heart, oblivious to the danger, dutifully pumps this tainted blood, unwittingly aiding the venom in its deadly mission. It's like a Trojan horse, hidden inside the life-giving blood cells, traveling to every part of the body. As the venom courses through your veins, reaching different organs and tissues, it starts to interact with them. Depending on the type of venom, these interactions can have various immediate effects. Neurotoxic venom, for instance, targets the nervous system, interrupting communication between the brain and the muscles. This can lead to symptoms like blurred vision, difficulty speaking, and ultimately, paralysis. On the other hand, hemotoxic venom targets the blood and cardiovascular system, causing damage to blood vessels and disrupting the clotting process. This can result in internal bleeding, a rapid drop in blood pressure, and potential organ damage. Cytotoxic venom, meanwhile, targets the cells directly, causing them to break down and die. This can lead to severe tissue damage around the bite area, which can spread if not treated promptly. In the midst of all this chaos, your body is doing its best to fight back. The immune system springs into action, producing antibodies to counteract the venom. But the venom's potency often outpaces the body's natural defenses, leading to a race against time as the toxins spread. The venom is now in your body, wreaking havoc. But what exactly is it doing? Stay tuned to find out in the next scene as we delve deeper into the body's response and the medical interventions that can turn the tide in this deadly dance between man and venom. As the venom spreads, your body isn't just sitting idle, it's fighting back. When a venomous snakebite occurs, your body quickly recognizes the foreign substance and springs into action. This is a tale of defense and survival, a battle fought on the microscopic level. Your immune system, the body's personal army, immediately sets to work. White blood cells, the soldiers of this cellular army, are dispatched to the site of the bite. Their mission, to neutralize the venom and repair damaged tissues. They do this by producing antibodies, proteins specifically designed to attach to the venom molecules and render them harmless. This process, however, is not instantaneous. It takes time for the body to produce enough antibodies to fight off the venom, and during this period, the venom continues to wreak havoc. As the immune system wages its war, the body undergoes various physiological changes. The heart rate quickens, pumping blood faster to distribute the antibodies throughout the body. Breathing becomes rapid as the body attempts to increase oxygen supply to aid in the fight. The skin might turn pale or clammy as blood vessels constrict, a defensive maneuver to limit the spread of venom. Meanwhile, the venom's effects become more apparent in the form of symptoms. Pain and swelling at the bite site are common as the body's inflammatory response kicks in. More severe symptoms might include nausea, weakness, and even blurred vision or difficulty breathing as the venom starts to affect the nervous system. But it's not all doom and gloom. The body is incredibly resilient, and these symptoms are signs that it's doing its job, fighting back against the venom's onslaught. Every heartbeat, every breath, every shiver is a testament to the body's relentless will to survive. However, it's important to note that while the body is a formidable opponent against venom, it doesn't always have the upper hand. The type of snake, the amount of venom, and the individual's overall health all play crucial roles in this battle for survival. The body is now in full battle mode, but can it win this fight alone? The answer, as we'll see in the next scene, often hinges on timely medical intervention. When bitten by a venomous snake, immediate medical attention is crucial. Let's delve into this a little more. Why is it so important to seek medical help as soon as possible? Well, the venom injected by a snake can wreak havoc on the human body, leading to tissue damage, impaired blood clotting, and in severe cases, even organ failure. The faster medical intervention is sought, the greater the chances of limiting these damaging effects. Now, you might be wondering, what exactly does this medical intervention involve? The cornerstone of treatment for venomous snake bites is something called antivenom. This is a medication made from antibodies that can neutralize the specific venom of the snake that bit the victim. It's a bit like giving the body a helping hand in its fight against the venom. But here's the catch. Not all antivenoms are created equal. Different snake species produce different types of venom, which means the antivenom used must be specific to the type of snake that delivered the bite. This is why it's so important for medical professionals to identify the snake species whenever possible. Beyond antivenom, treatment may also involve pain relief, wound care, and in some instances, surgical intervention to treat complications like tissue necrosis or compartment syndrome. The goal here is to manage symptoms, prevent infection, and help the body heal. Once the immediate threat has been managed, recovery can often take weeks or even months. This phase includes careful monitoring for complications as well as supportive therapies such as physical rehabilitation to regain strength and function in the affected area. It's a long and often challenging journey, but one that countless individuals have successfully navigated. The human body is incredibly resilient, and with the right treatment and care can often bounce back even from something as traumatic as a venomous snakebite. With the right treatment and care, recovery from a venomous snakebite is possible. So we've taken a fascinating yet terrifying journey into the body's response to a venomous snakebite. We've seen how a calm day can turn into a dangerous encounter. We've delved into the moment of the bite, where the venom first enters the body, and the subsequent spread of this potent toxin throughout the body's systems. We've learned about the body's valiant fight back against the venom and the critical role of medical intervention in halting this deadly progression. The body's response to a venomous snakebite is a testament to our survival instincts, our resilience, and the power of modern medicine. But as we've seen, it's a battle best avoided. Venomous snakebites can be deadly, and recovery can be a long and painful process. Remember, the best defense against a venomous snakebite is to avoid getting bitten in the first place. Stay safe out there.